Good day. My name is Michelle Levander, and I'm the director of the USC Center for Health Journalism. Thanks for joining us today for our conversation with author and journalist Sam Quinones and his new book, The Least of Us, True Tales of America and Hope in the Time of Fentanyl and Meth, a searing exploration of how synthetic drugs have transformed the face of addiction in America. Sam is a Los Angeles-based journalist. He'll be talking with us about his fourth book of narrative nonfiction. It follows his 2015 book, Dreamland, The True Tale of America's Opioid Epidemic, which won a National Book Critics Circle Award and was selected as one of the best books of the year by Amazon, Slate, The Daily Beast, BuzzFeed, and newspapers around the country. In 2019, Dreamland was selected as one of the best 10 true crime books of all time, based on ratings of more than 90 million Goodreads readers. His first two highly acclaimed books grew from his years living and working for 10 years as a freelance writer in Mexico. Sam also worked as a reporter at the Los Angeles Times for 10 years, covering immigration, drug trafficking, neighborhood stories, and gangs. And he's written for many other publications as well. You could tweet about this webinar at the hashtag opioid epidemic. This webinar is made possible thanks to the generous support of the National Institute for Healthcare Management Foundation, the Commonwealth Fund, and individual supporters like you. We'll be archiving this webinar later today at centerforhealthjournalism.org. A word about our format today. We'll be hearing from Sam first, and then we'll turn it over to our audience for questions. Because we have many people joining us on Zoom, we'll ask you to write your questions into the Q&A panel. You can write us there if you're experiencing technical problems as well. So Sam, let's get going. Really anxious to hear from you. In your prior book, Dreamland, The True Tales of America's Opioid Epidemic, you provided new insights on how the overprescription of pain medication in the 1990s coincided with the influx of black tar heroin from Mexico to the US, a combustible mix that led to the explosion of opiate addiction in hundreds of cities and towns across the nation. You return to the topic of drugs and addiction in your new book. Why was this book so important to write now? And how did the mass production of synthetic fentanyl and meth become such a game changer when it comes to who was getting addicted, the death toll from addiction, and the difficulty of breaking free from addiction's grip?
Yeah, thank you very much, Michelle, for organizing this and putting this on. It's great to be with everybody who are joining us, I suppose, from around the country. To me, this felt like just a continuation of what I was writing in Dreamland. Initially, I really didn't want to write another book after Dreamland because I was thinking old school, kind of almost a crime reporter for many years. And I thought, what's after heroin? Well, as the book came out and as it began to really, I think, create awareness of this problem nationwide, it began to encourage people to come out of the shadows, people who have been around, who've been, affected by this. Many of whom were really very quiet about it, really not wanting to have their stories told initially. And now they began to come out. And I began to get invitations all around the country to come speak. And when I do, I begin to understand that that I was wrong. That what comes after heroin is fentanyl. And I began to see this as a larger move away from plant-based drugs in the Mexican trafficking world. They had learned a lesson of what is why you would want, as a trafficker, to move away from plants with methamphetamine. And this was a radical departure for them because most of the trafficking world in Mexico really was, farmers, ranchers. They had grown up on the land. The land was what they knew. Their then children and grandchildren are seeing actually growing stuff according to seasons and all that stuff. Really doesn't make a lot of business sense. Much better to start making our drugs. The drug that taught them that was methamphetamine in the 90s. As they industrialized the production of that stuff. And then as the opioid epidemic grew in our country, they began to respond with heroin, of course, first. But along the way, in the story I tell in The Least of Us, an underground chemist wises them up to the idea that there's also a synthetic form of heroin, that you don't need to grow poppies, you don't need to worry about sunlight. So there's, with synthetic drugs, they come to understand this fundamental idea that you don't need land, you don't need rainfall, you don't need sunlight, you don't need irrigation and farmers and harvesters and all that kind of stuff. All you need is a lab, and you need a port. Now, land isn't important so much. Ports, shipping ports, access to shipping ports through which you can get access to the world's chemical markets. That is what is important. And if you do have that access, which they do, on the Pacific coast down from Arizona, about 2-day drive, you run into the state of Colima and the city of Manzanillo. And then after that, while south, you are in Michoacan, and you run into the city of Lázaro Cárdenas. Those two places have large ports controlled largely by traffickers, able to receive just container loads of chemicals needed to make these drugs. And that has allowed them something that we've never seen before, which is simply the staggering coverage of the entire country with these two drugs. It's very much like if you take a long distance trip in a car on the interstate, you will see that corporate America has pretty much covered the country with McDonald's and Cracker Barrels and Burger Kings and the same stuff, right? You know, you get the same offering pretty much the whole way. Well, that's what the underworld now has done with the drug trafficking offerings. Used to be that it varied very much by region, and it still does to some degree, but it's remarkable how much the coverage of methamphetamine and now fentanyl have just been from Vermont, to LA. And that is causing its own set of issues all across the country, both in terms of overdose deaths and in mental illness and homelessness.
And delve into a little bit more that idea of how addiction has changed because of these synthetic drugs.
Well, first of all, addiction, when it comes to fentanyl is the deadliest drug that has ever appeared on the streets of America by quite a bit. Due, in fact, to the nature of the drug, which is by the way, it's a wonderful drug. Okay, people need to understand that. It's a magnificent drug in the medical context. And I had a heart attack 4 years ago, and they gave me fentanyl when they put a stent in my artery and cleared it up, and I'm very happy that they did, and thank them very much for that. But obviously, when the hands of it's extraordinarily potent opioid, much more so than morphine or heroin, of which it's very connected chemically, and so it's an extraordinarily potent thing, and not to be in the hands of traffickers, which is, of course, is what's happening now. Addiction to fentanyl now is what's happening. People have, at first, it was put into heroin by the local dealers, and people started overdosing. Now what you're finding is across the country, people have reached a tolerance to fentanyl. They're no longer going to be okay with heroin. Heroin will not keep the dope sickness away. So, and soon there will be no more heroin on our streets. It's almost there already. But certainly fentanyl is raising the tolerance. This means that people are even though they have high tolerance, it's extraordinarily dangerous because there's no mixing on the street that can be careful enough to keep eventually you from getting a bad mix. And so the truth of the matter is that there is no such thing as a long-term fentanyl user on the streets of America today. They all die eventually. It's almost a certainty that people are going to die because there is no way for the trafficking world to mix this stuff properly. Initially, in the book, and the least of us, I write a chapter about how initially the myth was that you could mix fentanyl best. The underworld myth was you can mix fentanyl best using a magic bullet blender. And so narcotics agents would fly these magic bullet blenders at all these sites where they'd bust these people. And this thing you can buy at Target for $29.95, and magic bullet blender is fantastic for smoothies and salsa. And we personally own one. It's fantastic machine. It is not good for mixing powder, and certainly not for a dangerous drug like fentanyl. So it's made death more of a certainty. Fentanyl has on the street, honestly, once you're addicted to it, or once you're just using it, anything right now. And then also methamphetamine has changed, I believe, in the last 8 years. And the stuff coming out of Mexico, again, in simply staggering quantities. Coast to coast, they have covered the country with methamphetamine, and the price has still dropped by 80%. It's an unbelievable story, frankly. Just that alone is an amazing story. But along with that meth, this meth seems to be accompanied by very serious symptoms of schizophrenia, of mental illness, paranoia, scary paranoia, and then hallucinations of things coming out of the walls, things all around you, paranoia that seems to last after you stop using the drug, after your detox, and so on. And then along with that, you get with that you get, I think it's I'm very convinced, I think my reporting has shown that you get a big increase in very quickly those folks are homeless and living in tents. They can't live in a homeless shelter. The homeless shelter is too scary. There are too many people that they think are threats to their own. And so tents actually end up being the perfect lodging for those folks. All of this is kind of ways, there's a whole bunch of things we could go into, but this is kind of like the basics for how things have changed with massive quantities of synthetic drugs, fentanyl and meth coming out of Mexico today.
And Sam, your book is sweeping in its reach, but you tell these stories about this change through characters with lots of reporting on the ground. One of those characters is Tommy Rao. What does his untimely death tell us about these synthetic opioids? And what other characters did you come across and illustrate these trends that you were just talking about with to make it real to your readers?
Yeah, Tommy Rao was from Akron, Ohio. A very nice family, whom I met. Spent time with them. His story is about exactly what I was just talking about. Tommy Rao got addicted to opioids because he was prescribed, I think it was OxyContin, for a carpal tunnel syndrome, which is a nonsensical prescription for a thing like a carpal tunnel syndrome. But then also when he had his wisdom teeth extracted too, so he's addicted, he then switches to heroin, tries heroin one night after he's fully addicted to these drugs and pretty much getting him now on the street. Now he tries heroin, and after that, he didn't want to try anything else. Tommy Rao struggled all his life from 19 or 20 to the day he died at 37. He struggled all his life to get clean. But the story of Tommy Rao is a long one, a complicated one, but suffice to say, he lasts 15 years addicted to heroin, and he doesn't last 2 months once fentanyl hits the streets in Akron, Ohio. He dies in the spring of 2015. One of the first people to die from this new fentanyl that's hitting those areas. Turns out back then this fentanyl is coming from China. That's where it was originally coming from, and mailed through the mail to people who realized that they could buy it online from Chinese chemical companies. That's now really stopped. The Chinese government stepped on that and reduced that significantly, but they still make the precursors. Those precursor chemicals they now are selling in large amounts to Mexico. Mexican traffickers have learned how to make the stuff. But back then, 2015, Tommy died from an extraordinary, bad mix. He had the highest dose of a fentanyl analog called acetylfentanyl in his system that anybody had ever had in the previous year or the 2 years that followed his death. But it shows you exactly the point. It doesn't matter how veteran or tolerant your body might be. You don't last with fentanyl on the street.
And Sam, another one of the characters who really captured my imagination in the book is somebody named Dr. Lou Ortenzio, who's a small town doctor in Clarksburg, West Virginia. You talk about Purdue Pharma's opioid marketing strategies and how they, prompted him to overprescribe pain pills that led to dozens, if not hundreds, of his patients becoming addicted. And yet you paint him sympathetically. Tell us a little bit about why you portrayed him that way and why you felt so much sympathy for him.
I think it's because this idea that pain pills could be prescribed to people without risk of addiction. It was sold by pharmaceutical companies to doctors. Doctors, well-meaning, very well-intended, like Lou Hortensio, in a small town where things were kind of falling apart. You know, it was a Rust Belt phenomenon was breaking in. It was a glass manufacturing town, and all the glass factories were leaving. And so his motivation was entirely a good one, that I need to save my town. This stuff is happening here and they need my help. And he would see his patients until 10 at night. You know, it became kind of like him against a tide. These pills were sold to doctors as a boon, as something to help your practice. This can help people overcome their pain. It can get rid of those really pesky chronic pain patients, just get them out of the waiting room real quick. You don't want them around too much. And the idea was that doctors, this will solve a problem for doctors. And of course, what it ends up being for a lot of doctors, like Lou Hortensio, is a curse. You know, it's not that they start out corrupt. It's that over a period of time, with the plentiful nature of the pills and all these people coming with needs and very needy, and he can't say no, and he ends up using his own supply in a sense, using this free samples that he's given and that kind of thing. That leads to a major addiction lasting several years until he's finally discovered and tried, loses his license, ends up. Doc O, this like beloved doctor for years in this town, ends up delivering pizza to the people that were once his patients. And with that, he feels like liberated. You know, he told me he felt like, thank God, I don't have to work until 11. I'm bringing them pizza. The kids all love it. The pizza guy is here. It was with every pizza, he was like kind of found freedom and redemption in a sense. And now he runs the homeless shelter in Clarksburg. He sits on the board of the probation board and the drug court board. It's a fascinating story because he was the first one in that town to openly embrace his own recovery and let people know. People knew the story of Doc O all across that town, and he embraced it. He was not one of those, you know, urchins under the overpass. He was somebody everyone knew and spent time with and loved. And 100 people write letters in his behalf saying this is a wonderful doctor and this kind of thing. And he, I thought part of his story was beautiful for that reason, that he wasn't afraid of his own recovery. He saw that a lot of good might be done by just coming out and saying, this is what I'm doing. And yeah, I'm loving delivering pizza. People felt embarrassed for him when he was delivering them pizza. And he didn't feel that. He felt like this is liberation, you know, and away from the dope, away from feeling like I have to solve everybody else's problems, you know, that kind of thing. So his story was really, though, a story I was trying to tell for a lot of doctors out there. There are some doctors who are quacks and just immediately, you know, fall into corruption. Most doctors who fall into that, though, don't do it immediately, coast downward for many, many years, and their intentions are very, very good until they end up finding themselves in this predicament that he found himself in.
And in the later chapters of the book, Dr. Hortensio returns. You know, early on, he appears as the one who, you know, gets caught up in dispensing all these pills. And he becomes part of a kind of group of people in Clarksburg who are trying to really figure out how they can, as a town, address how addiction has overtaken so many people. And you also talk about other people who have this kind of civic effort, people like Angie Odom, and you say that these chapters where people are trying to help the least of us, hearkening back to your title, are some of the most important ones in the book for you, because they explore something that journalists often overlook, this idea about volunteerism, a civic spirit, and people quietly refashioning a community destroyed by addiction. What role is there for a kind of journalism that delves into this often overlooked generous spirits like Angie and ultimately Dr. Hortensio?
Yeah, and I thought this was essential. I mean, I would say since then, I've even been more convinced of that. A lot of interviews, I've been doing a lot of interviews about the book, and people want to talk about fentanyl, and they want to talk about methamphetamine and the harrowing damage, the homelessness and all that, and I'm happy to do that. But the stories that really enthralled me, the stories I'm most proud of, are the stories of simply, that the main theme of this book became, if all these nasty, sinister forces are arrayed against us, and that doesn't even, we aren't even talking about all the legal addictive stuff that is, refined to hit our brains and social media and sugar and fast food and all that kind of stuff. If all of this stuff is arrayed against us, what is our defense? And I think that, I came to believe that community repair, the sense of community that we evolved to not just prize, but absolutely require, kept us alive throughout our, the eons and so on. I mean, to me, so that these folks' stories, I felt needed to be prominently told, and that the stories all have a few things in common. One, they're very unsexy. There's not like anybody is putting them on the news or anything like that. They are people working in small, quiet, unnoticed, daily ways to just help make their community a little bit better. Not to say that I'm trying to be a prescriptive kind of idea, that this is what your county needs to do to deal with this problem. Rather, that this is an attitude we need to understand, that we're as strong as the most vulnerable. We're as strong as a community as the least of us. We all can be that addict eating from the trash. So the story of Doc O and the folks who come together to help the meth addicts weather a particularly vicious winter a couple years ago. It's the story of a guy named Bird who lived in a small neighborhood, South Muncie, Indiana. As that neighborhood began to disintegrate due to factories falling apart and the opioid problem, the city has closed the community center across from his street and where he used to work, and they thought that was the end of it, except for that Bird kept the key. Bird kept the key and became a community center unto himself. And people would go to him and say, and he would open the community center and for kids to play basketball and old folks to play cards. He mowed the lawn. It was a big lawn. He would fix the toilets. It became this place where this very vulnerable neighborhood kind of weathered the enormous stress that it was going through for many years. So these kinds of stories I found to be most important, and I'm proud of them because you don't get any press releases pointing you to those stories. It's just stories that you find because you're looking for them, because you think they're important. So from a journalist point of view, you're not going to get a PIO saying, "Hey, we're doing this." Bird's keeping the community center open, and the city didn't know anything about what he was doing, didn't want to know probably too, and so it's these kinds of stories that do require you spending time in places that are not sexy, and not kind of easily identifiable. And you follow, with that story I came upon because a guy mentioned at a conference, like a one sentence thing. He said, we're trying to revitalize this South Muncie neighborhood, and there was this guy there named Bird who he just kept the thing open for a while, and that kind of tided people over until other people could see that what was needed. And when he said that, I just said, "Oh wow, that sounds like a story I might want to." And I'm going to be up in Muncie a little bit. How about if we meet? And he told me this. The fellow who told me the story. It's following that hunch. It seems to me essential for journalists nowadays, because we all are kind of guided by social media, and social media doesn't find this stuff. You have to find it on your own, it seems to me. You have to show the desire to find it and then follow through.
And Sam, you talk about how, so many people have kept hidden the true cause of death of relatives who are dying on the streets. And it seemed to me that a subtle thread running through the book is to maybe help to reduce that stigma by showing how these are really ordinary people with productive lives who become addicted, starting from prescription pills. And tell us, how easy is it for someone like that to just slip into an illicit and underground world and lose their moorings?
Well, I think it's happened many, many times, hundreds of thousands of times across this country over the last 20 years or more, really. I mean, it's so easy. Remember, these are opioids we're talking about initially that started this whole thing out, and they have an enormous and powerful effect on our brains, and they transform the brain. They hijack the brain in very serious ways and turn the brain away from self-interest and self-protection primarily, and community, which keeps us alive, and instead turn us away from that and turn us into folks whose only interest is in finding more dope. And to me, that is what characterizes addiction more than almost anything else. It's the turning away from the impulses that keep us alive: food, sex, community, and also the threat of imminent death. All of that is blunted. All of that is redirected towards focus on finding more drugs. And I think that's really the story of many people all across this country over the last 25 years as they got addicted to these pills.
And Sam, I want to return to something you touched upon earlier, this idea of P2P meth and how it contributes to today's homeless encampments, which you refer to as meth colonies. You have a chilling line. You say, you don't typically overdose and die on meth, you decay. So tell us about what your reporting found about the relationship between meth, mental illness, and homelessness, and what that reporting suggests about the strategies to address homelessness.
Well, the meth changed. The way Mexican trafficking world made meth changed in 2009, and then really amped up after that. That there are, hold on one second, that it began to change when the Mexican government made one chemical in which meth was made illegal, and that is that right about then is when it changed. As that happened, Mexican trafficking world had to change and found another way of making methamphetamine using a method that involves a precursor known as P2P, phenyl-2-propanone, and that method has almost no benefit over the ephedrine method. It's very messy, it stinks, it's all that stuff, except that it's you're able to make P2P with a variety of different combinations of industrial, legal, very widely available, and very toxic chemicals, and that's what they began to make, and that allowed them to make much more meth than ever possible before. With the ephedrine meth, they could make as much meth as they had ephedrine, and that was usually hundreds of tons, but it was enough to really cover like the parts of the western United States. Never made it east of the Mississippi River. What you're seeing now with this meth is that it's exploding, and you see it, as I said, covering the entire country, all the way from LA to New England, which never had any meth of any kind ever, and in any significant quantities anyway, and lower the price. But this, and I thought that was the story. Initially, I thought that was the story. That was the story I was trying to tell. This is an amazing capacity, never before seen, an unprecedented thing, what they've been able to achieve in Mexico. Now, then I find another story though, and that is that along the way, this meth is also accompanied by very rapid onset symptoms of mental illness, primarily schizophrenia, paranoia, very severe paranoia, very quickly, and also hallucinations, deep hallucinations, florid hallucinations of things coming out of the walls, and so on. And when that happens, then what begins to happen is also those folks cannot live with other folks. They begin very quickly to get homeless and hit the streets, and they're not able to live in homeless shelters either, because every homeless shelter is packed with people who they perceive as very, very threatening. This meth is now everywhere on the street, and it's that, I think, a big part of why we have the tent encampments all across this country, because tents are perfect lodging for someone who is in that state of mental imbalance, where the entire world is a threat. A tent is a place where you can be alone and kind of protected in your own little world, away from all the threats. And I think that's what's happening. And the fascinating thing is that none of this ever really happened with ephedrine meth, which was not good. You would decay over many years, but this is clearly not happening. This kind of thing was clearly not happening with ephedrine meth. It is certainly accompanied by this P2P meth, and what you're also seeing. Yes, we have massive homelessness in LA, Seattle, Denver, Sacramento, et cetera, all these different cities, Phoenix, Vegas, and so, et cetera. But you're also finding this in towns and cities that never had any homelessness really to speak of at all. In rural areas, Clarksburg, West Virginia, where Doc O, Lou Hortensio is located, just was overwhelmed when the P2P meth came to town. Very quickly, within a year, there's dozens and dozens of people, maybe hundreds of people on the street, ripping up houses, really seriously mentally ill. And I believe this is really a major driver in all that's going on out there when it comes to this meth coming out of Mexico in just staggering quantities coast to coast, is a major driver of what we're seeing with regard to homelessness and mental illness and tent encampments all across the country, really.
And Sam, as you know, a lot of the conversation around the increase in homelessness and the intractable problems has been framed by many as an affordability issue, about economic precariousness. And you have faulted advocates and even reporters who you feel have missed this story about the role of P2P meth. You call it willful myopia. What suggestions do you have for how reporters can better track these synthetic drugs and in their communities, the human toll, the community and law enforcement response, and these changes in drug production and how they've changed the landscape for addiction and recovery? I mean, what steps can journalists take locally to keep track of all this?
Well, I mean, I think it's, first of all, let me say that I think it's an absurdity that I would break this story. I'm a book writer. I write books that take 3-4 years to prepare and publish. This is a story that's out there for anybody to find, and it just takes willingness, it seems to me. And what I think what needs to happen, frankly, is a return to journalism 101, where you're not censoring yourself with some, kind of woke sensibility that says you cannot talk about a certain way about people who are we deem to be victims. There are many kinds of homelessness. There's a lot of different kinds of homelessness, but I think the tent homelessness is it's not hard to find the connection. And it's especially amazing once you start talking to people all across the country who are on the front lines of this, who see this every single day. The stories are all the same. It's amazing, the same. Rural Indiana, Eastern Tennessee, Columbus, Ohio, Portland, Albuquerque, LA, the stories are just end up being the same. When this meth comes to town, all of a sudden our homelessness problem, our mental illness problem goes through the roof. Why is that happening? As I say in the book and I say in the story, I don't know. It hasn't been studied. I'm not a neuroscientist. I'm not doing mice studies or rat studies. Those studies have not been done. But the unbelievable, the very, very deep connection is there for everybody to see. So I think I think it's a very I'm happy to have broken this story. I really think I'm very proud of having done that. But I also think it's a very scary thing that this should have been broken by reporters on the ground who are working for daily newspapers, radio stations, et cetera. It seems to me that has a certain kind of self-censorship that's going on that reporters need to understand. You need to leave that at the door. That part of your job is to leave that political stuff, whatever political beliefs you have or any of that, you leave that at the door when you walk in the building. That's a really, really important thing to understand. You cannot really function as a journalist. You will miss major stories. You will miss aspects to stories that you thought you've covered and you really haven't, because you're unwilling to talk about certain things. Now, I understand too that newspapers particularly are under enormous pressure. There's a lack of funding. There's fewer people than ever. All of that is part of this as well, it seems to me, because it's a story that takes some understanding, to take a lot of time to develop. But I do believe that there's this unwillingness to talk about methamphetamine and the meth coming out of Mexico when we're discussing homelessness, as if it's an issue entirely connected to the high cost of housing. The high cost of housing is very high in Los Angeles, Seattle, San Francisco, elsewhere. Of course, it's astronomical. But it's hard to see how, number one, in a lot of cases, that has anything to do with why that person's homeless, and number two, getting that person out of homeless. Could be that person's homeless for another reason, but once on the street, the meth is so prevalent that person falls into meth use, and with that, it becomes extraordinarily difficult to get that person out of it. So either way you want to look at it, this meth is a major part of this story and needs to be addressed. My feeling is, at most newspapers nowadays, you need a synthetic drugs beat. You need somebody who is following this stuff daily, because it's that important. It's that ever present all across our country today. It is changing drug use. All the ideas that we had about how to deal with drug use and drug addiction are being called into question because of the stuff that's out there on the street in such staggering quantities, as I say, out of Mexico.
And I just want to, you had mentioned something that I thought was interesting earlier to me, which was that, people who are like the city hall reporter or the county reporter, or the health reporter, might need to delve into some other arenas, like go down to the jails and understand, people who are involved in this underworld. Tell us a little bit about that. I mean, that's not typically what you would do as, say, the health or county reporter.
I definitely believe a lot of my reporting has been done based on seeking interviews in jails and in prisons. I did my first jailhouse interview when I was a crime reporter in Stockton, California. I think it was 1990. So 31 years ago. And ever since then, I have done those interviews. I've done many for this one and for Dreamland as well. And I just constantly do them because you can find out amazing stories. And I do believe that you need to now start reaching out to other people. I also believe if you're going to cover homelessness, if you're going to cover issues related to a lot of different things, but certainly if you're going to cover drugs in America, you absolutely need to know about Mexico. Mexico is the source of virtually all of our drugs of abuse on the street, and it is taking people, some people who have mental illness, partly that's why they're homeless, and making that mental illness much worse. It's taking people who are addicted to opioids or heroin and killing them with fentanyl. I mean, all of this is changing drug use. We have these ideas about drug addiction and drug use on the streets now that are old. The drug world has surpassed that, passed that way by. And so now you need to understand that what you may have learned and thought might be a good idea, and people might be proposing as a good idea, when the drugs were far more forgiving, is now not such a good idea. Whatever the case, it seems to me that these drugs are so prevalent now that they change everything.
And you're touching on something. I want to follow up with a final question. I know we have a number of questions already in the Q&A part of Zoom, and want to urge everyone else, we're about to turn to your questions, but you talked about this idea of our ideas about how to address addiction being outdated in this new world. And of course, progressive cities like San Francisco and even President Biden have advanced the idea of harm reduction strategies to address all this. And for some, that phrase means setting up safe spaces where addicts can shoot up using clean needles rather than demanding that they come clean as a first step to becoming healthy. So given the potency of these new synthetic drugs, can these strategies work? Or have they overwhelmed our arsenal of public health responses? And if so, what will bend the curve?
Yes, they might work in some circumstances, but on the whole, I think the key thing is you need to get people off the street. There is nothing compassionate or kind or merciful about leaving a person who's addicted to fentanyl or leaving a person who's addicted to meth on the street. You know, harm reduction is great. It seems to me leaving someone on the street is harm enhancement. They are going to die. They are going to become progressively more mentally ill. And I'm not sure how I see that as compassionate in the least. So now what do we do about folks? I believe that what is being tried already in some areas in some parts of the country, but we need to understand that that with every day out on the street, these folks are playing Russian roulette, right? And we also need to understand that people who are selling those drugs, it's not like selling a bag of marijuana 10 years ago. If you're selling fentanyl, something includes fentanyl, that's about the same as firing a gun into a crowd. That's how dangerous it is. The likelihood of hurting or killing someone is enormous. So I think we need to understand that just not arresting people because they're selling minor amounts of drugs, it seems to me to be allowing the corrosion of the rule of law, number one. But number two, it seems to me that it also, you are not helping the person who most needs help, which is the person who needs to be off the street. I believe that now what you're finding is people are understanding that these folks need to be arrested and detained, not to send them to prison, but because this is the first step towards detoxing them, number one, and number two, and getting them into treatment. The idea that somehow it's okay to leave people on the street, I just think is madness right now, and I think the streets are showing that madness all around the country. It also requires, they're very important on it. I have 3 chapters in my book that talk about this. It requires we rethink jail entirely. Jail has always been this anchor around our necks when it comes to this stuff, right? It's just really difficult to move forward in anything. If you come in mentally ill, addicted, or criminally minded, you leave worse. Now what you're finding in many other states, although I don't think California is really one of them, is that they are, particularly states that have been at this for a long time with the opioid epidemic, Kentucky being a leader, by the way, is transforming jail into recovery centers. Part of the jail is a recovery pod. The one I talk about in the book has now 3 pods. It started with 1, in which people are there, and they opt into it once they're in jail, and then they opt into it and they begin the process of recovery. They're making their bed, they're taking classes. There's jails built with classrooms attached. I mean, that's another radical idea, but I think a lot of these ideas are necessary now because you simply have to get people off the street. There's no harm reduction coming. You can give people Narcan and you can revive them with Narcan, but that means only that you have saved them once. The next time they use, later that afternoon, 2 days from now, in a friend's trailer, whatever, when there's no Narcan, that person will die. There has to be something more than Band-Aids. And Narcan is a magnificent tool, and it needs to be everywhere, like fire extinguishers. But it's also clear that it saves people once. It doesn't really do much to deal with their deeper problems.
And you may feel like you've already answered this, but Joseph Samsel has a question that seems to really build on what you're saying. He asks, do some of the policies that cities like Seattle and Portland impose actually lead to unintended consequences when they handcuff police from arresting some of the drug addicted, mentally ill homeless population that have been affected by methamphetamines and fentanyl?
Yes, I would agree with that. I think that's a real problem. We got this idea that the drug war failed and therefore we have to step away completely. My feeling is the drug war failed to the degree that it did, not because we use law enforcement, but because we only use law enforcement. Now we need to use a wide community-based approach to all of this, connecting mental illness and addiction in a way that they've always been so separate and dealt with in different ways, even in different buildings. Frequently in counties, you find this to be true. To me, this is all part of this idea that we need to get away from this one single magic bullet solution to a very complicated problem, and understand that these things all are connected. You cannot talk about this problem without talking about methamphetamine out of Mexico. You also cannot talk about it without dealing with the very, very severe mental illness issues and the lack of mental illness housing and the lack of ability to commit people for more than like 72 hours, which is nonsense. There's all this and many, many other things we probably don't have time to talk about here, but is being called into question, I think, by all that what's coming out of Mexico and the way the drugs are absolutely changing.
And Carla Johnson asks, with opioids, we have effective medication-assisted treatment. What have you found about treatment, medication, or otherwise for methamphetamine addiction?
There is none. There's very effective harm reduction medical treatments for opioid addiction. These include methadone, and Suboxone and Vivitrol, and they do a lot to subdue the cravings, which is such a problem for people when they're in recovery, and that's wonderful, and they need to be widely available and accepted too as part of this mix that I'm talking about, this community kind of mix, and they're extraordinarily important. There is no such thing for methamphetamine. The only way to really recover from methamphetamine is to not use it anymore, is to be away from it, separated from it. Another reason why it is in no way merciful to leave people out on the street once they are using this stuff, particularly given the prevalence of it. It's just so prevalent. If you're a woman on the street, fentanyl, methamphetamine, certainly in LA, the people I've talked to, methamphetamine can almost be free. Certainly, if you are a woman being prostituted by a pimp, pimping is now making wide use of methamphetamine and fentanyl as a way of controlling the women that are being pimped. All of this is part of this kind of unholy mix that goes on the street, and particularly so when you allow people to just stay out there, in a tent.
Shireen McKinney says, it's great that you insert humanity in the face of addiction by sharing the Dr. O and other stories. It seems irresponsible to paint the doctor as not knowing the effects of pharmaceutical opioids. Do you address how doctors get a chance of redemption, but people with less social capital don't get such chances and don't get to start over?
Yeah, that might be true, actually. That's true. My feeling with writing the story of Doc O was to say, though, that there was, at the time I began that story, there was a lot of talking about how the folks on, the doctors had been kind of, we're kind of a piñata to beat around, and that's true. And there were some that really needed to understand that. I would say, though, that in the case of Doc O, he seems to. I wanted to capture the problem that doctors faced, the relentless patients demanding, and a prevalent pills, and these salesmen just endlessly coming by the office, pushing this stuff. That was the nuanced story that I thought would be interesting to tell. Sure, there are many people, you can tell that story, and you can tell the story that the person, the questioner just posed, which is, what about folks with far less social capital? Absolutely excellent question. It hits me almost every day when I'm doing this. How do you come out of this stuff when you have so little on your side? It's part of the many thousands of stories, literally thousands of stories that you could probably tell out of this entire story or issue that we're talking about today.
Dana Smith says, Nick Redding did a lot of reporting on the meth epidemic in the Midwest in the 1990s and early 2000s, and who those people were and why they started using. Who are the people using this new type of meth, especially in regions of the country where meth wasn't previously popular? Is it people who were using opioids and fentanyl and switched drugs, or are fentanyl and methamphetamine separate but parallel problems?
No, I would say that they're connected. A good question. They're connected in that a lot of folks now, particularly in the Midwest, where the opioid problem is very severe still, have switched. And in part, there's several reasons for that. One is it's just so dirt cheap, right? They're on Suboxone to control their opioid cravings. I found this a lot. On Suboxone to control their opioid cravings. And at the same time, they haven't received addiction recovery needs continuum of care, just the way heart attack patients like me need a continuum of care, after care, or whatever you want to call it, where for a heart attack patient, it involves, seeing cardiologists, pills, exercise, all that kind of eating better, all that kind of stuff. Well, addiction recovery requires aftercare or continuum of care as well. It's just different. It requires being there, finding ways of paying off probation fines, getting your driver's license back, housing, a variety of like community-based things, like finding good meetings to go to. A lot of things like that are what I think are really part of the of the mix, and frequently that's not accompanied by, say, by some of the medically assisted treatments, just the treatment, and that is all. Frequently, what you find is that people have really not done the life repair that needs to be done, and they need that. These are the kinds of services that need to be available for people all across this country, and frequently they're just not. And so a lot of those folks are still wanting to get high. They haven't done this kind of life repair. They don't want to get high on opioids. They don't have the cravings as much because they're taking Suboxone or methadone or Vivitrol, but they still want to get high. And so methamphetamine comes along and they begin to use that. Those are not the only people, but that was a remarkable thing, because in the history of drug use in America, you don't find opioid users, heroin addicts. Never. When I was a younger reporter, I would never find heroin addicts switching to methamphetamine or vice versa. In fact, there were two separate camps. One didn't like the other, and they would talk bad about the other and that kind of thing. Now we're seeing that all across the country. And in some areas where the opioid epidemic has not been a big deal, it's simply that meth has always been, like in LA, Vegas, places like that, Montana too, those kinds of areas. You just see a lot of this methamphetamine. I can't stress enough too the question of supply. Once you have those quantities that quantity of dope coming through, it's just a matter of time before other people get caught up in it, who may not have, again, they may be addicted to other things, or they may be just on the edge of the drug world, and then pretty soon they get swept up in it. Supply creates its own demand very, very often, and that is something I also don't think we talk enough about. But certainly the folks in Mexico understand it.
And Keith Rosendahl says, do you have advice for new journalists to stay physically safe and emotionally resilient while finding and telling stories like those you've uncovered?
Yeah, man, go to the jails and the prisons. Find the people that can tell you some of these stories. They're there. And I've done that. I can't tell you how many. When I was at the LA Times, I did 50 to 100, I can't remember anymore, interviews with Latino gang members from Los Angeles. You'd be surprised how easily people will say yes when you write to them and say, hey, and for Dreamland, all the Mexican traffickers that I interviewed in Dreamland, I think there are like 8 or 9 that you can count. All of those were interviewed in prison, in American U.S. prisons, where they were at that time doing time. To get to those 8 or 9, I probably wrote letters to maybe 60 or 70. I can't even remember that anymore either. But I always reach out to people in prisons and jails, because that's the source. That's the story you almost never hear. On the street, you're not going to hear that story. No one is gonna. They're not going to be in condition. They're not easy to find. You're not going to be safe. Whatever. There's a lot of reasons not to do it on the street. It's when I find that when people are in prison, particularly, maybe also jail, honestly, it's when they've had a lot of time to think about their lives. They become very, very eloquent. I found this especially among Latino gang members, Sureño gang members connected to the Mexican mafia in the prisons in California. After a while, after they've been down 5 years or so, something like that, maybe longer, they're in their late 30s, early 40s. They are so thoughtful. They can tell, they told me the entire history of the Mexican mafia moving out of the prisons and establishing a taxation system on drug dealers in their respective neighborhoods. I learned that almost entirely. Well, I learned the details about from guys I interviewed in prison. So prison is safe. People have a lot of time on their hands. They're thoughtful, and you know where to find them. And man, the stories are really lacking. Their stories are really lacking from, I think, from the coverage that we've got that we've seen of all these issues: gangs, drugs, homelessness, you name it.
Sam, Deborah Becker says, won't rethinking jail take a long time? Right now, many people say they are worse after incarceration. Instead of rethinking jail, shouldn't we rethink treatment?
No, I believe jail is quicker. You can transform jail very quickly and more cheaply than running it this way. People leave jail worse off, absolutely, because jail's been done one way. It's way. Think of what we do. We take an addict who's on the street, obedient to the dope for months, arrest him on some charge, bring him into jail. He detoxes, and at that very moment, in jails all across this country, we put them in that guy into a situation where, first of all, it's utterly tedious. Nothing happens. You watch Judge Judy all day long. Then there's these predatory moments. There's moments where nothing positive happens. You leave worse. You absolutely, as what I said earlier, that if you're criminally minded, mentally ill, or addicted, you will leave worse from jail. And that is a sad thing, because there's these moments, I think, particularly folks who are struggling with addiction, when they come, they're detoxed and they're like perceive the wreckage of their lives. And it's at that moment that they want something different. And it's at that moment that traditionally all across this country, we have put them in situations that continue the problem horribly. And then they get out and they go right back. It's like this cycle that's horrible to watch. And I think in many areas, what they're seeing is, let's use that moment in a different way. What it does require is political will. You need people you need also, I believe, elected jailers. Kentucky's a leader in this because it elects its jailers. That's one reason. They're accountable. They have constituencies they have to please. They have to make amends for the money they spent, that kind of thing. And they are the ones, very conservative guys, a lot of them are saying, wow, what am I doing? Let's try this a different way. This is not a panacea. There is no panacea for this. What I'm saying is that when you rethink jail, it begins to make you rethink a lot of other things too. And pretty soon you begin to think, oh, it's not just jail. It's that we don't have a shuttle to take these guys to an area where they can get their clothes after they get out of jail. So a lot of guys come in emaciated from the street in August, right? They spend 6 months, they bulk up on all those carbs that you get in jail, and they come up in February they come out in February much heavier without the clothes that they need for the weather that they're going to face. Well, they need a place to go after that. They need a shuttle, not a bus, because on the bus they're going to meet up with old buddies, and that's going to be their downfall. There's all these little things that begin to grow when you think of new ways of doing jail. And in these jails that I've been to, they do criminal addictive thinking, they do GED classes. These are classes for folks where they're sitting around working on their recovery. Some relapse, of course, this is addiction we're talking about, but it is still something I think that is extraordinarily important to understand that we need to do. Jail is one of the real anchors around our neck when it comes to this stuff. It needs to change, and the thinking is out there, it's happening.
We'll take one last question from Tiffany Magley, who says, how do you propose that we help those that are homeless, that are currently in a drug-induced psychosis and do not want to go to treatment? I work in harm reduction, and a big part of our position is to build trust with individuals that use drugs so that hopefully we can connect them to other resources, including treatment.
Yes, and this is a terrific work, and it's a very, very important question. Part of the problem is that on this new meth, it makes it extraordinarily difficult to develop those intimate connections that you do need And part of it is because it's very difficult to have a conversation and develop a connection with someone who is psychotic, who is seeing things, who is imagining every black car passes by, it must be the FBI, you know, that kind of thing. That's why I believe in using jail as a resource. These new drugs require that. It's no longer like a nice idea. It's you got to get them off the street, you got to detox them, and then it's at that point when the harm reduction that the questioner is talking about can actually make a difference, and treatment then becomes something that follows that. Again, this is not, the idea is not to arrest people so that you can get them into prison. We tried that, and it's been a failure very, very often. The key thing is to understand that you cannot leave them on the street. You just cannot leave the people in this condition on the street. It's not compassion. It's not harm reduction. It is harm increase, it seems to me. And so again, but it gets to all this idea that the drugs on the street are changed. That's what they say on the street. Fentanyl changes everything. So does meth. And it changes all kinds of ideas that people are operating under that come from another context of drugs that may be 5, 10, 20 years old.
Yeah. Well, I just want to point out, but we'll stop now, that Tiffany had a reply that when people go to jail and get drug charges, they're no longer eligible for government housing in Kentucky, at least. So this is all very complex.
Sure.
But, Sam, this has been such a provocative and fascinating conversation. So I want to thank you for your time and your insights, for journalists and everybody else listening into this conversation. I also want to thank our audience for their really excellent questions. Should you want to support us in this kind of work, here's how to do it, so we can continue offering webinars like this. And we will be archiving this webinar later today on centerforhealthjournalism.org. We'll be sending you a survey shortly, asking you for your feedback on this webinar and future ones. And I want to thank everybody here. I'm sorry we couldn't get to everyone's questions, but I hope you all feel like we had a rich discussion, and want to wish you all well.
Thank you all.